Good day, class. In this video, we are going to start a discussion on the syndrome differentiation. The syndrome differentiation is another important content in the diagnostics. So in order to treat the disease, firstly, we need to know what's the disease. The second is where they are. So how do you know what it is and where they are? Also, we want to know how violent they are. So it's very similar in a war. You want to know your enemy. Where's your enemy? How many soldiers do they have? What kinds of weapons do they have? How powerful they are. So that's how to fight with the enemy. Same as the disease. When we treat the disease, we want to know where they are. What's the characteristic of them? Because our treatments, we can treat the disease according to the symptoms. So how do you know where they are? Or what's the nature of the disease? Or how violent the disease is? That's from the syndrome differentiation. That's something we're going to study. And as you can see from your textbook, the syndrome differentiation includes these eight different type of differentiation methods, the eight principles, etiology factors, disease nature, in other words, the qi, blood, body fluid, also the 脏腑 organs. So the 脏腑 organs can help us to locate where they are. From these the eight principles, such as the excessive syndrome, deficient syndrome, and then if you see a patient with such as with fatigue and loose stool, and also reluctant to talk. So you can see that's a kind of this deficient pattern, deficient syndrome. But the diagnosis of deficient syndrome is not enough because you don't know where. So you need to identify the lung deficiency or the spleen deficiency. Then from the treatments, you can use the treatments to improve the lung function or the spleen function. So that's the combination of the eight principles and the 脏腑 organs. So we're going to study these four. There's another four differentiation method, the 6 meridians, the 4 levels, 胃, qi, yin nutrition, and blood levels differentiation method, 三焦 differentiation, and also the meridian differentiation. These 4 differentiation methods, we're going to have very brief introduction of the 6 meridian, the 4 levels, the 三焦. The differentiation method of the meridians, we're going to study from the acupuncture and moxibustion in the second years. So that will goes along our study towards the acupuncture points, the location. So that part, the differentiation of the meridian, we're going to study in the second year in acupuncture and moxibustion. The 6 meridian, the 4 levels, and the 三焦 differentiation method, we're going to have a very brief introductions to them, and you can have a general idea or general impression that we have this kind of differentiation methods. So we're not going into details of these 3 differentiation methods. The reason is these 3 differentiation methods are more linked to the exogenous factors. Mostly when we use these 3 differentiation methods, we're going to treat the disease with herbal medicine more with herbal medicine instead of acupuncture. So you can use, if you want to, as just in general, in acupuncture, we don't use that much of these 3 diagnostic methods. These 3 differentiation methods. If you need to use the 6 meridian differentiation method, the brief or a simple one you can find in the differentiation method in the meridian. That's be the one we're going to study in the 2nd year. And also the 6th meridian differentiation method is a 1-year course itself. This differentiation method comes from 伤寒杂病论. So until now, you should remember when I talk about 伤寒杂病论, that's the one of the 4 classics in 220 AD from Zhang Zongjing. So this differentiation method is from the classic, and it is very important for the herbal medicine study. The 4 levels differentiation method, 胃, qi, yin, blood. These 4 differentiation methods developed in the 17th century, and this 4 levels differentiation methods mostly we use in the wound disease or epidemic diseases, or in other words, exogenous diseases due to heat. The Sanjiao differentiation method also developed at the same time of the 4 levels. So these 2 more linked to the internal and more linked to the herbal medicine. So we will have a brief introduction, but we're not going to focus on that. We're not going to go further there. The other reason, also very important, is the Sanjiao differentiation method is actually another way to group, or another way to group the 脏腑 organs. So in 脏腑 organs differentiation method, we talk about the lungs problem, the lungs syndrome, the heart syndrome, the spleen syndrome individually. In Sanjiao, they categorize the lung and the heart in upper jaw, the spleen and stomach in the middle jaw. So that's another way to talk about the 脏腑 organs. You can find similar content in this differentiation method. So for this study, we will focus on the previous 4, especially the 脏腑 organs. You will know the reason after we have studied the 3. When we study these 3, the 8 principles, the etiological factors, disease nature, you will know that you will have a general idea of the patient, but you cannot locate where they are. So it is very similar. If I ask you to find something in one house, I tell you that the stuff I ask you to find is in the 2nd floor, in a flat. The flat have the wall of the flat have a gray color, and then the door also opened. So you see from these descriptions, to find one object in one flat, you know that the stuff is in the 2nd floor. In that room, the door is left open. You try to find the flat with a gray wall. The color of the wall is gray, but you don't know where. That's very important. You have the address on which street, which number. So that's the 脏腑 organs. So from the 8 principles, we know that the deficient or the heat or the cold, or the interiors, also we can know it's the exteriors or interior. We can find the factors from etiological factors such as due to the wind, or the disease nature, qi deficiency or blood deficiency. That's where. Is it the lung qi deficiency or the kidney qi deficiency. That's why we need to use the previous three as the foundation of the Zangfu organs. So these four are the differentiation methods that we are going to focus on. These three are the fundamental foundations from the Zangfu organs. And Zangfu organs is one of the most important differentiation methods we are going to focus. So there's a patient, 31 years old, presented to the clinic with palpation for 2 months and a history of chronic edema. A few years ago, he started with edema in the face and eyelids. You ring any bells that the edema starts from the face, start from the eyelid and face. When we study the inspection, we talk about the edema. What kinds of edema? So you can refer back to your notes. He received treatment for this, but since then, he has recurrent leg edema. Over the past 2 months, the patient has palpitation, soreness, and coldness in the lower back. So this axial coma and fatigue. There's a pale complexion, leg edema, abdominal distension, scanty urine, pale enlarged tongue with white coating, a deep, slow, and deficiency pulse. So these are all the clinical informations that we gathered from the consultation. From the inspection, you see the pale complexion, pale tongue, enlarged tongue, the leg edema. From the inquiry, you know that this patient suffered from palpitation for 2 months, and also he suffered from the edema comes and goes. He has treatment before, but recurrent. From the palpation, you will see the patient, the edema is pitted edema. And also for inquiry, you will know the soreness and coldness in the lower back. So, and from the palpation, you can feel the deep, slow, deficient pulse. As you can see, these are all clinical informations that we can gather from the 4 diagnostic method. This is also an example of the present disease history. When you write a present disease history, you're also going to write in this structure. Very briefly, a few sentences, you need to describe all the information that's related to the current disease. When a patient presents with these information, how do you analyze these manifestations? What kinds of problem the patient has? So after this study of the 8 principles and combined with the other differentiation method, you will learn how to analyze and how to summarize the conclusion from these manifestations. So firstly, we're going to talk about the 8 principles differentiation method. The 8 principle differentiation method includes the exterior and interior syndromes, cold and heat syndromes, deficiency and excess syndromes, yin and yang syndromes. So why there are 8 principles? That's because these 8 and exterior, interior, cold and heat, deficiency and excess, yin and yang, these are called 8 principles. These 8 principles also not at the same level. The reason is it can be 2 principles with 6 divisions, because yin and yang syndromes, it refers to the previous 6. Yin syndrome refers to interior cold deficient syndrome. A yang syndrome includes exterior heat and excess syndrome. And so we're going to study one by one, and also you can see from here these 8 are actually 4 pairs. These pairs that are opposite to each other. That's why they can be categorized into yin and yang. We are going to introduce one by one of these syndromes. The first one is the exterior and interior syndromes. The exterior and interior syndromes is the most common and most important principles to identify the disease location. Exterior or interior, and severity, how severe they are. So from the definition, we see that the exterior syndrome refers to exogenous pathogenic factors and a mild condition. So when you combine with these 2 sentences, that's why I'm here, you will see that exterior syndrome manifests as a mild condition. The cause is from exogenous pathogenic factors. What's the exogenous pathogenic factors? That's the wind, the coldness, the heat, summer heat, the dryness, and the fire. So these exogenous factors, and also a mild condition. A mild condition also sometimes can indicate the cause of the disease. It won't be long. Okay? So these are the characteristics of exterior syndrome. The manifestations, the patient may have chills, fever, headache. Chills, mild fever, headache, body ache, nasal obstruction, sneezing, runny nose, scratching or sore throat, coughing, panting, pale red tongue with foam coating, superficial pulse. So as you can see from the manifestations, we actually put different symptoms in groups. An exterior syndrome is where the antipathogenic qi fights with the exogenous pathogens in the superficial skin. Because when these pathogens invade our body, it invades from the nose and mouth, from the skin, and then in the meantime, our antipathogenic qi need to fight with them. Because the war happens at the superficial level of the skin. So the location is exterior and also superficial. Attack the surface of the body, but just be careful that the exterior syndrome happens in the surface of the body, but diseases on the surface of the body is not all in the category of exterior syndrome. So we're going to have an example in the next slides. Now you know that the reason for the exterior syndrome is because the fighting of the antipathogenic qi and the exogenous factors fight in the superficial level. Then you will understand how to analyze these symptoms, what's the cause of the symptoms. So in this study, in the differentiation study, it's very important to remember the signs and symptoms. It is also very important to understand how to analyze. So in a test or in your assignments, you might be asked to explain why the patient will have chill, why the patient will have fever, why headache or body ache. So you need to learn how to explain these manifestations. The explanation you also can refer to the textbooks, the analysis. So the chills and fever, that's because the pathogen, the antipathogenic qi is fighting at superficial level, so the patient will have fever and chills, or aversion to cold, headache, and body ache. That's because the qi block the meridian. It can block the meridian in the body or in the head, which results in a headache or body ache. The patient also may have a thin coating and superficial pulse. So these four are the key symptoms of an active syndrome. A thin coating, what's the color? A thin white or thin yellow? So the coating, what's the color of the coating in an active syndrome? It can be white or yellow. A thin white coating means the cause is from the wind cold. A thin yellow coating means that the cause of this active syndrome is the wind heat. So as you can see here, we combine the characteristics of coldness and heat together. So a thin coating indicates the active syndrome, but doesn't matter yellow or white. A superficial pulse. What's a superficial pulse? Floating pulse. More specifically, it is a floating pulse here. So you also can write floating pulse. These four are the key characteristics of an active syndrome. So when you diagnose, you need to try to find out does the patient have these four. It doesn't have to be all, but at least that's the references for your diagnosis. So now we understand the active syndrome happens in the superficial level of the body. It happens, the cause is from the 6 exogenous factors. So here, the first picture, the gentleman suffer from a sunstroke due to the summer heat. So it's very hot. That's the heat. And then for sunstroke, the patient will have fever and then faint or unconsciousness. So in this condition, does this sunstroke considered as active syndrome? That's a question for you. Does the sunstroke consider as an active syndrome? In order to answer this question, you can go back to the previous slides. What's the characteristics of an active syndrome? It must be from the cause, must be from 6 exogenous factors. So the sunstroke, it can be considered as one of the exogenous factors, the heat or summer heat. So that's the cause matches the active syndrome. The patient have a fever, so that also match the manifestations. The patient faint, lose consciousness. So the patient is unconsciousness. Now you need to be careful. An active syndrome refers to a mild condition. So you can see the orange letters in the previous slide, in orange color, a mild condition. This patient already become unconsciousness. So this is not a mild condition. So a sunstroke is not an active syndrome. And when we study in future, you will know that this is an interior syndrome due to the internal heat. So not all the superficial symptoms are active syndromes. The second image, the patient got the abscesses in the leg. It is here a leg. So on the skin, is this an anterior syndrome? So we go back to the definition or the manifestations. The patient have the abscesses. The patient may have a fever, so that matches. In the superficial level of the skin, the abscess happens on the skin, so that's the location is also in superficial level. But the abscess, most of them is due to internal heat. When we study in future, you will know that how to treat this kind of problem. We're going to clear the internal heat of the body. That's how to treat the abscesses. And also the duration of the abscesses, the course of the disease may be longer, and also it's not a mild condition. So this one is also not an anterior syndrome. So as you can see from here, an anterior syndrome doesn't matter. It's not only categorized by the location or the exogenous factors. You have to identify or to diagnose as an anterior syndrome. They have to match superficial exogenous factors, a mild condition. So in a mild condition, it also can be the early stage of a disease. The patient may have cough, runny nose. Why the patient will have cough and runny nose? That's because the exogenous factors go through the mouth and nose, affect the lung, cause the lungs dysfunction, and results in mild cough, mild panting. So that's all mild because this is a mild situation. The floating pulse. The floating pulse we have introduced previously. Why the pulse will be floating? When we study the pulse diagnosis, we also have explained why the pulse will be floating. That's because the qi fights at a superficial level, so it pushes the pulse to superficial as well. So that's why the patient will have a floating pulse. So these are the discussion on an anterior syndrome. If you understand the anterior syndrome, it will be easier for you to understand an interior syndrome. An interior syndrome. An interior syndrome, when you see from the manifestations, it's quite complicated, but it's easier to understand. The reason is you can see an interior syndrome manifests as pathogenic factors entering the Jiangfu organs, qi, blood, and bone marrows. In other words, the internal interior syndrome manifests many symptoms, can be all kinds of different symptoms. That's why it says has a vast, extensive signs and symptoms, which can cover all clinical manifestations. So there are many manifestations. How do you know it's an interior symptom? The key aspect is non-exterior syndrome. So as long as it is non-exterior syndrome, it refers to the interiors. Although here is an intermediate syndrome, we're going to introduce just briefly what's an intermediate syndrome. So as long as non-exteriors, non-intermediate syndromes considered as an interior syndrome. So when if in a test, I ask you to write down what's the manifestations of an interiorized syndrome. You can just write down anything as long as not floating pulse. So that's the interior syndrome. Here I will change the notes that you can change to syndrome. We're going to use the syndrome all the time. We will keep the syndromes here. So these are the difference between an exterior and interior syndrome. Most importantly is the pulse, the tongue, and chills and fever, aversion to cold. So the pulse for an interior is deep. That's similar. When we study a deep pulse, it goes deeper as interior compared with the superficial. Deep is interior. An intermediate syndrome between the interior and exterior. This syndrome is a very typical syndrome. It is described as alternating chills and fever, fullness of chest and ribs area, vomiting, poor appetite, bitter taste, dry throat, blurred vision, and the pulse is wiry. This syndrome actually from伤寒论. So it describes that this kind of symptom have both, not only have both the exterior and interior. If a patient presents with both exterior and interior syndrome, is it possible? Is it possible for a patient to present with both exterior and interior syndrome? The answer is yes. You will see from the previous case, that patient have both. But this is not an intermediate syndrome. An intermediate syndrome is an alternating chills and fever. Sometimes the manifestation presents with the exteriors, sometimes it presents as interiors. So it not happens at the same time. When it happens at the same time, it can be the combination of these two, though it doesn't consider as intermediate syndromes. Intermediate syndromes can have alternating chills and fever. That's the key symptoms. Alternating chills and fever described as the patient feel chills and then after a while feel fever. And after a while, the patient feel aversion to cold again and feel fever. So change comes and goes, comes and goes. So this is just a brief introduction of the chills intermediate syndrome. So these are the differentiation between the interior and exterior syndrome. And most importantly, you need to remember how to identify the exterior syndrome. What's the characteristics they have, such as mild condition, exogenous factors, and aversion to cold or chills, fever, mild fever, body ache, floating pulse. So these are the key aspects of the exterior syndrome. Thank you for your attention.